Hello all. Today we will see the working of glucose liquid stable test. The kit is by Biolab Diagnostics. There is one bottle of glucose reagent and there is another bottle of glucose standard of 100 mg concentration and instructions for use. Apart from this, you will also require to clean and well calibrated pipettes of 1000 microliters and 10 microliters each. In glucose, we use plasma for testing and hence we use the fluoride tubes. As you can see, glucose is a ready to use reagent and there is no requirement of preparing the working solution before performing the test. This is the fluoride tube as mentioned before. As per the procedure, we need to take three tubes for the blank, one for standard and one for test. We need to take 1000 microliters of reagent only in the first tube of blank. In the second tube of standard, we need to take 1000 microliter of reagent and 10 microliter of standard. In the third tube, take 1000 microliter or 1 ml of reagent and 10 microliter of patient sample. Mix the above mixture at 37 degrees Celsius for 15 minutes and aspirate the reagent mixture and record absorbance. As you can see, there are three test tubes of blank reagent, standard, and test. We are putting 1000 microliter or 1 ml of reagent in all the three tubes. As the reagent is same, there is no need for changing the tip. Read the instruction manual clearly before performing the test. Now, change the pipette and use 10 microliter of standard for the standard tube. This is a 10 microliter pipette. Mix the mixture thoroughly. Now we will use the patient sample. For this, kindly change the tip so that there is no cross interference. 10 microliter of patient sample is taken from the fluoride tube and a reaction mixture is prepared for the third tube of test. Again, mix it thoroughly and incubate the mixture for 15 minutes at 37 degrees Celsius. Once this is done, program glucose on the semi-automatic biochemistry analyzer. Here we have already programmed the machine for glucose. Now, as you can see, there is aspirate water. We are aspirating water now. It says please remove the tube. Now it says aspirate reagent blank. So we use the first tube and we aspirate reagent blank. Please remove the tube and after a small lag time of 4 seconds, we will see the absorbance. Save the result and as it says aspirate standard. use the second tube of S and aspirate the standard. Now we will get the absorbance and factor of the standard after a small lag time. This is the absorbance and factor, save the results. Now again use standard tube so that we get the concentration of somewhere around 100 mg. Now, since we have received this, we can use the patient sample from the third tube of test. Now we will get the result of the patient sample. The patient reading is 59.26. Thank you.